Okay, so here's our compression wrapping lab, and if you haven't already gotten the page out of Blackboard that coincides with this, you might want to go ahead and do that real quick right now. There's points for that handout, and there's some things I'm going to go over during this lab that you're going to need, and it's just easier, I think, to have that in front of you. So go grab that, and what we're going to do today is demonstrate different types of compression wrap. First of all, let's talk about the patient populations that are appropriate for compression wrap. So any patient that's got edema, and we're wanting to reduce that edema to promote healing of a wound. So a few things we want to think about ahead of time. We need to make sure that they don't have a history of an acute DVT, and so we would want to run blood tests for that. And we're going to ignore my cat here, who I knew as soon as I started talking she's going to get in it. So we want to make sure, rule out that they don't have an acute DVT. Another contraindication would be an acute infection. So if there's, here we are. If we were in the lab, you would not be entertained like this. So this is just free entertainment to keep you all occupied and paying attention. This is Miss Maisel, and she's going to help me with wrapping today. So acute DVT, acute infection. Obviously, we don't want to do compression wrap if there's an acute infection involved. Another issue would be acute dermatitis. So you want to make sure there's not some type of inflammatory condition going on the skin in general. If the person has psoriasis or anything like that, we definitely wouldn't want to do some heavy wrapping on that. And then lastly, we need to check ABIs. So remember what your threshold is. As long as the ABI is 0.8 or higher, you're pretty much okay to do compression wrap as is. The gray zone is when we get below 0.8 to about 0.6, 0.5. We're reducing the amount of compression that we've got. We want to be very careful about that, but you get down to about 0.6 and below, you really can't do any compression wrap. You are going to encounter patients that have a combination of venous insufficiency and arterial disease. So you're going to have to weigh the odds. There's many times where I do choose to wrap because the arterial disease is not significant enough. Their ABIs are in the 0.7 range. I'll go ahead and wrap them. We get down below that though, then your potential for wound healing becomes very minimal anyway because there's not enough blood flow, and you certainly don't want to make that worse by doing any wrapping. So those are patients that you would have to discharge. So let's get started with wrapping. The first choice we're going to make is the patient ambulatory? This patient's ambulatory, so we would like to do a wrap that has a high active tension and low resting. So a patient who's ambulatory, so that as the calf contracts, it pushes against the wrap that you've put on, and that's where the pressure is maximum. So active patient, you're thinking more of a short stretch bandage. Sometimes you don't have a choice. So let's talk about some reasons on why we would pick different types of dressings. One would be finances. Maybe the patient can't afford, they don't have good insurance, you may have to use what you've got. So try to find something that's the close, short stretch bandage that you're able to do. There may be tolerance issues. The patient, in the beginning, sometimes I have patients that have very limited tolerance to wrapping. And I usually start out with a little less compression than normal, just to kind of make sure that they can tolerate it okay and increase it the next time they come. You also want to think about patient mobility. Can they take the wrap off if it's uncomfortable? That's definitely a precaution and a potential contraindication, because if the patient is physically unable to remove the wrapping, then you want to be very careful about putting a wrap on someone if there's not someone else around that can take it off when need be. So other than that, I think those are the main ones. So let's get started with the first type of wrap. I'm going to start from the very bottom and just start with a basic ACE wrap. Why would we do an ACE wrap? Well, maybe this person has mixed disease and you're just trying to see how they can tolerate. So it's a long stretch bandage. It's going to give as the person ambulates. Or maybe the person is not ambulatory and you're going to start with more of a long stretch bandage. But on some occasions I'll start with an ACE wrap just to see what their tolerance is. So let's look at the technique. What we're going to do is a figure 8. So when you're doing compression and the type of material that you're using is applying compression, you in general want to use the figure 8. So let's start with figure 8 with a ACE wrap. Okay, so here's basic ACE wrap. We're going to start at the base here. We want to try to minimize any wrinkles. This is a large ACE wrap. Patient's going to hold her foot up. I'm going to ask her to dorsiflex up like that. and this one is not a good one, it's too big. Let's at least get started here. And I want to do a heel lock around the back. This is an old ace wrap, people. And normally wouldn't have any wrinkles, but this is a really big ace wrap that's had some years to it. And we'll work our way up. Figure 8, overlapping by half. Maintain the same amount of pressure as you go up. And remember Laplace's law that as the leg gets larger, the circumference is larger, the pressure is less, but as you maintain the wrap, that's going to give you a natural reduced pressure. So that would be just a basic ace wrap. You would put your dressings on first, obviously, apply the ace wrap, and then tell the patient to remove it if they have any discomfort. Okay, so basic ace wrap. Okay, and here's a short stretch bandage. This comes in different sizes. It's used most commonly for lymphedema. I also use it with many wounds, and again, it may be someone that I've already gotten down to baseline and I'm trying to make a decision on what type of home garment I'm going to get them, but this is a really good short stretch bandage, so it has a high active pressure and a low resting pressure. And we'll start at the foot again. It's got clips. You want to get rid of those clips. Clips are bad. You want to secure it with tape. And the reason is because they can come off at night, and if the person has any neuropathy, they won't feel it, and it could stick them or stick the other leg. And so just get rid of your clips. So you'll start at the base. With this particular short stretch bandage, you're going to go up in a spiral. So you do the heel lock. She's in dorsiflexion. And ideally we don't want wrinkles here. And then we're going to go in cylindrical, and we're overlapping by about an inch each time at an angle. With a short stretch bandage, you're not so much pulling as you're just taking out the slack and angling up. And at whatever point you run out of wrap, you're going to grab another one and start and finish your wrap out. And then if there's remainder, then you can cut it. So that would be a short stretch bandage, about an inch overlap. And again, it's a good choice if you're trying to basically assess patients' tolerance. It's easy for them to get it off. A high active pressure and low resting pressure. You like that, Maisel? Okay. Okay, now we're moving to a multi-layer wrap. The first multi-layer wrap that I'm going to use is Coban 2. It's a 2-layer wrap. It's a short stretch bandage again, okay? So in here, they have a handy little stockinette to put on top. We'll talk about that in a minute. They're going to help you out. In case you're not sure what goes first, most of these multi-layers will actually have numbers on them to tell you. So the first one is basically a soft foam type structure, and then it's got Coban embedded into it. So you would put your wound dressing on first, make sure it's secure, and then start your wrap. You're always starting at the base of the foot. Make sure you don't impede the little fifth digit here, that she's got room. Come around the back, lock the heel, and then you're going to do a spiral on the way up. No need to pull, you're just taking out the slack. In fact, it does best if you just roll it against the skin to take out the slack. Overlapping by about 1/2 as we work our way up. You have to pull to unravel it, pull, and then reduce what you're doing pulling, because you want to make sure you're not pulling excessively as you're wrapping this around. And sometimes, if these have been on the shelf for a long time, they're stuck, and you have to kind of free it up. Okay, so we're not quite at the top, so what we'd have to do is get another box, and we would finish that last, looks like 1 revolution to be safe, and then secure it. Patient, I'm going to have you put your hand right here so that doesn't go anywhere. And then we're going to start the second layer. Always good to have tape handy, because you would want a piece of tape there to secure that. Now we've got Coban for the second layer. Now, in the directions it says to apply this the same way in a spiral, and you can do that. Sometimes I go ahead and do a figure 8 because it does give a bit of compression. It kind of depends on the patient and how well it's fitting. I'll do a spiral in this one for now, because Coban, it does have some elasticity and give to it, so it's a short stretch because it has a short range of elasticity, but there is some give. So we'll start just shy of the first layer for patient comfort, and we're going to do the same thing. Come around the back, lock the heel. Wrinkles at this point don't matter as much because you're far enough away from the skin. And then here's where you start your figure 8. Spiral, sorry. See, I do figure 8 with this one a lot. And spiral on up, overlapping by about half. Notice as I unravel it, I release it and let it come back down so I don't apply overpressure. So how many millimeters of mercury would this one be? Well, and I would cut it at this point. That's all we would need. Cut the rest of that. So at this point, this is about 30 to 40 millimeters of mercury pressure, which is what you want for someone with venous insufficiency who doesn't have any precautions or contraindications. Someone who has a little bit of arterial disease, maybe in the 0.8, 0.7, you're not going to be at 30 to 40. You're probably going to be around 20 to 30. How would you do that? You would have more slack on this. Instead of taking out all the slack, you have a little bit more give to it. But even better, you would probably go to a 4-layer, which gives you even more control. So the benefits of a multi-layer over a single layer is you can control the amount of pressure that you've got. You can range it from 20 to 40 with much better control. It's more comfortable. The more layers you've got, the more comfort it is for the patient with this pressure on their leg. It's more absorptive. So again, the more layers, the more absorptive that you have if there's a lot of drainage. They're probably going to last a little longer with a multi-layer because of the absorptive properties. And it can be taken off in stages. If the patient says that they start to have some discomfort, I'll instruct them, well, take the outside layer off first and see how you feel. Oftentimes, once you take that outer Coban layer off, the pressure discomfort relieves enough that you can tolerate the rest of it. So definitely a multi-layer wrap is kind of the gold standard when we're talking about wrapping for venous insufficiency. So let's see what a 4-layer multi-layer wrap looks like. Okay, so here's the 4-layer wrap. There's many different brands out there. This just happens to be the one that our hospital has, the 4Flex. So it starts with a cotton layer for comfort. We'll start here. So again, you've already put the wound dressings on and it's secure enough that it's going to stay in place while you wrap. So with this one, you want to make sure you don't pull. You see what happens when I pull, it gets more narrow. So you definitely want to just lay this down. Have the patient dorsiflex. There you go. And we want to be pretty careful about not too many wrinkles here. And we're going to go up like a spiral. So we'll spiral up, and I'm overlapping by about half so that we have some symmetry here. You see where my guide is of the previous one. Kind of smoothing it out with the other hand. You want to come over the calf. For a wrap to stay up, you really want to kind of come above the bulk of the calf muscle so that the back of the dressing can kind of rest on the calf, and that kind of keeps it from coming down. Okay? All right. The next layer in a 4-layer, it's pretty much a short stretch. Doesn't have a whole bunch of give to it, but it's got a little bit of give. And again, it's kind of transitional from the cotton, and it's pretty thin. But if I were to pull this tight, it's going to apply a lot of compression. So I just want to make sure it's snug, but I'm not overly pulling. It's going to go up in a spiral. The hardest part is what I'm doing right here. This is what you would want to practice. And if we were in the lab, you would want to be able to do what I just did there. It should become second nature to you. Getting around that heel and not having a bunch of wrinkles is takes practice. So I'm going to spiral up, overlapping about a half. All I'm doing is taking out the slack. You're going to mess up when you pull like this. You're going to create wrinkles and discomfort, and it's not going to be symmetrical. So maintain your steady amount of pressure and lay it against the leg as you go. If you're out here, you're going to have more trouble. So kind of keep it laid against the leg as you go. Okay, then we would tape that down. Patient's going to hold that because I still didn't get any tape. Okay, third layer is basically an ACE wrap. So here's our short stretch bandage, and look how much stretch we've got here. That is definitely long stretch, excuse me. It's a long stretch ACE wrap. You can go from 0 to full. Often I will document in my note that I might have used 50%. And so my colleagues know that if that's 0 and that's 100, then that's 50. And yes, it's subjective, but you do have a fairly good idea by looking at 0 and 100 what about 50 is. So the first time I wrap somebody, I don't pull it all the way tight. I'm going to be somewhere 50 or a little bit less on this. So with the ACE wrap layer, it is in a figure 8. So now we're going to do a figure 8. We're going to do about 50%, okay? Use 2 hands. One hand helps smooth. You notice how close I'm keeping the roll to her leg. The more I'm out here, the less it's going to do what I want it to do. Now with the figure 8, I'm starting my figure 8. Maintaining that 50% pull. Nice, smooth, no wrinkles. Maintaining that 50% pull. And the other good thing is if you keep your hand down, you're not going to have to start over, which is, you'll only do that once or twice, and then you have to start all over with your dressing. And then I would tape it down. For now, I'm just going to tuck it here. Don't ever do that. Make sure you tape it because it creates some bulkiness back there. Might need you to, just in case. All right, last. So at this point, how much tightness do we have here? We're probably in the 20 to 30 range right now about, because the cotton really didn't do anything. The second layer had a little bit, but I didn't pull it much tightness to it. The third layer, ACE wrap, was about 50%, so we're probably 20 to 30. This is going to put us up to 30 to 40, because now we're back to the Coban. It's going to go on like the other Coban did. Yes, there's stretch to this. I want to keep it snug, but not pulled all the way tight. I'll be telling the patient, if you have any discomfort, if it's uncomfortable, take this layer off and see how you feel. Obviously, discomfort's going to happen the more active the patient is. So sometimes the discomfort happens because they've just been up a lot and they really feel all that pressure. I'll tell them, well, go lay down for 10-15 minutes with your ankle 30 degrees above your heart and do some ankle pumps and see if that discomfort goes away before you start removing the dressings. Okay, again, if I pull all the way tight and wrap here, that's going to really increase the pressure. So I want to ease off on it, about 50%. And yes, again, that's fairly relative because everybody's 50% will be a little bit different. But if this is her first time wearing this, I'm not going to go all out with the pressure. Now, I can also increase that as she comes back as her tolerance is good because I want to be closer to 40. 40 is really what my goal is. And with some people, if it's a large person, maybe someone who weighs over 300 pounds, you're going to be above 40. Some of the pressures in those legs are 50 to 60 is what we need. And so with a multi-layer wrap, you can get to that. You'd be pulling more into that 50-75% tightness range and apply it in the same way. So this is a good wrap. It's comfortable. We've covered pretty much everything. She's got some room here to peel back if it gets uncomfortable. She's got some room here. The cotton comes up to the top. That's what you want because it can fold down. So that's a multi-layer, 4-layer wrap. Okay, as I was taking this off to prepare for the next one, I remembered that I didn't tell you about the stocking. Let's talk about the stocking. This is important because the Coban sticks to everything. And the patient is going to tell you that they weren't comfortable in the bed because the sheet stuck to it, their pants stuck to it, and so sometimes they end up taking it off because they're frustrated by that. So if they could put a stocking on top, so normally this would still be on. This is not a compression stocking. You watch how easy it is to put on. It has little to no compression to it, but it provides a smooth barrier so that when they get in bed at night, it's smooth. They don't stick to everything. So this is a nice adjunct to it just to make it more comfortable. If this doesn't come in the brand of compression stockings that you have, tell the patient to either put some hose on or powder. A lot of times powder will smooth that down too. Now in some of these packages, they have tape in there that you can use, little stair strips, and they actually have a little bag for you to put their shoes or old dressings, whatever is in there. So nice little stuff to some of these different brands. Okay, so now we're going to talk about the patient's wound is now closed and we're looking for prevention of wound recurrence. So we want to get them in some type of compression garment. It's just not realistic that a patient's going to wrap themselves. So the wraps that we use are for an open wound. Once the wound is closed, we want to move them to a garment. If the patient has venous insufficiency, it really is your long-term goal that they are independent with some type of compression garment for edema management for prevention of recurrence. That should be a long-term goal on every venous insufficiency patient. If you fail to do that, you are not completing your responsibilities as the caregiver to that patient to help them be educated on how to prevent this from coming back. So one thing that we do, we want to make sure that their edema is at baseline, that the swelling is at as little amount as it can be in the leg. And it should be there. By the time the wound is healed, you've been wrapping them all this time, their edema should be at baseline so they're ready for a garment. I usually go ahead and measure them when I think we're about 1 to 2 weeks out, really closer to about 1 week, or whenever you recognize that they're at baseline. And that's easy. The patient comes in, you measure them, they come in the next day, you measure them, the edema measurements aren't really changing anymore. They're at baseline. Most all of the brands that I'm about to show you just require 3 measurements. So one would be at the ankle, and you're getting measurements in centimeters at the ankle. And then again at the largest part of the calf, and again it's somewhat subjective, but you're just estimating about the largest part of the patient's calf, and you get your measurement. I've got this backwards here. Here we go. You get your measurement. And then also they want to know leg length, because some of these actually have small and large for regular and long leg folks. So you would go to the base right at the fold of the knee and come down to the heel with the foot dorsiflexed, and you would measure that length. Okay? All right, so the very first one we're going to do, when I first graduated, this was pretty much my go-to dressing, and it was compression hose. So I didn't really have many options that are out there now. They've really come a long way with giving patients lots of options based on many factors that we'll talk about. But this particular hose, you would measure, and it had different sizes that would coincide with the numbers that you had. It was a 2-layer hose. The first layer would go on and basically provide maybe 12 to 15 millimeters of mercury pressure, and by the time you put the second one on, it would either put them into 20 to 30 or 30 to 40 depending on what you had ordered. Now any patient that doesn't have arterial issues really should be 30 to 40 if they've got venous insufficiency. But some of my patients with mixed vascular disease, I would go down to the 20 to 30 to help improve their tolerance, not put too much occlusion to the arterial system, but then also help maintain that venous insufficiency edema. So I'm going to go ahead and struggle with these because we're going to talk about why I don't use these anymore, and you're going to see one reason. So you want to make sure that you can get them open or closed toe. I do occasionally still have some elderly patients that prefer these, and if they want those, then I'm certainly going to order them for them. I want the patient to be happy with what they get. That's really the most important thing. If the patient likes what they have and they can get it on and off. So start here. Make sure that this lines up with the toes. There's a blue shaded area here for the heel. We want to make sure that that comes over the heel. And I'm going to look and make sure that I see that that blue is at the heel. And then we're going to work up. Watch how I go as I pull up. You see where my fingernails are away from the patient's skin? I don't want to be grabbing like this or I'm going to tear it. It's best if you come here and come up like that. And you can get your wrinkles out. If you have a wrinkle way down here, you're going to do better to come here and pull it out than to try to go down here and pinch it up. So that's the first layer. Then the second one, if you've never put them on, it helps to kind of stretch them. Get all the way down to the foot again. Make sure you get it lined up on the foot. Get it straight. Come over the heel. And then pull up. Okay, so that would be standard hose 30 to 40. And the patient can move this if they need. If it's too tight, you can't cut it. If you cut it, it's going to run all the way down. So, the benefits of this, it's streamlined. It's not too hot for them. Definitely the skin is more breathable. Downsides, it's hard to put on. It's hard for me to put on, but think of the patient. Think if they have arthritis. Very difficult to, some patients can't get to their feet. They haven't touched their toes in years, which is partially why they have sores distally. So the practicality of physically, can they put them on? Second problem, if they're hard to put on, they're probably not going to take them off very often. And what I end up seeing is people leave these on, and they leave them on, and they leave them on, and we get fungus among us in here. They're not washing them enough, they're getting hot and sweaty. Fungus loves hot, moist environment, and it starts to itch, then they're scratching. It's a problem. Next problem, they're not adjustable. What usually happens is they start to lose their elasticity, and 6 months later you see the patient again because they have another wound, because they kept using the same stockings, they began to wear out, and they just kept using the same stockings until they got another sore. So they're not adjustable. So putting all of that in mind, they're also not as durable. There's your fourth reason, durability. So if we look at hard to put on, they don't usually take them off enough, so they end up getting a fungus. They're not adjustable because they usually lose their elasticity because they're not real durable. They lose that fairly quickly. You usually need a new pair within 6 months at the best. So there's your downsides for the stockings. Let's look at some other alternatives, okay? Okay, so before I move to your other compression garments, I'm going to briefly talk about the stockings just a little bit longer. So they have little footies that have open toes, and so that's an option. Some might put these on, and then they have stockings that are just anklets that coincide with this, and they come in different colors. You've also got different brands. So this is just a single layer, and it's much thicker, so it's even harder to put on than what I just showed you. This is what I used to use a lot too if I was just going to do a single layer for someone, and it's open toe. So lots of options. Again, it's the size of whatever fits the patient. Another option, I believe this is also a single layer. So here's Medi, another single layer. If you're just using a single layer, they're much thicker, so they are going to be more durable, but then they're also more difficult to put on, so you need to keep that in mind. Now, if the patient can't afford anything and they don't have any insurance, this is something a patient brought in. You know how you see on TV, or sometimes people that still get the newspaper, you'll see these ads for compression garments that they can get for $10.99 or $15. A patient actually brought this in that he had ordered online, and they're zip up. And granted, the amount of pressure is maybe 20, but you know what? It's better than nothing. And if, at all odds, anything that we can do to reduce the edema is better than not doing anything. So this is actually a fairly reasonable option for somebody that doesn't have availability to anything else, and it's affordable, and it's fairly easy to put on with it being a zip up. You also now have, if you think of your compression stockings from your athletic stores, It's really popular now. Some of those can be a good 30 millimeters for a while until they start to wear out. Those are some other options for patients if they want something simple that might be a little bit more affordable to them. But let's talk about what I consider kind of the gold standard now for maintaining prevention of wound recurrence with keeping the edema under control with a compression garment. Okay, so here's the compression garments. First of all, people ask, what about the legs? Well, I like to give people antifungal ointment for dryness of the skin, mainly because if they're wearing these garments all the time, just like I mentioned with the stockings, you get fungus quite often. So you want to make sure they're bathing regularly and they're putting on a moisturizer, and it's really good to have something that's a little bit antifungal in it if they don't have any contraindications to that, just to cut down on the presence of fungus. So here's my favorite compression garment. It's Circade. Again, it's fitted to the person's leg based on your measurements. It has 3 parts to it. First is an inner liner. The inner liner is basically just going to be a barrier between the actual garment and their legs, so that this would be washed on a daily basis, and they may actually only wash the garment maybe once a week. It's much more tolerable in the washing system, doesn't wear out as much, especially if you're not washing it every day. They need to wear something under it though. If they run out of these, which a lot of times you don't get more than 1 per box, you could use just a pair of socks, plain pair of tube socks, as long as it comes up and is a barrier. So this goes on first. It has an open cuff and a closed cuff. The closed cuff is down at the ankle. The open cuff is so that it can expand. So we'll put this on first. It's not difficult. It's not that tight. Easy to put on once you get over the heel. You're just going to pull it up. Make sure you get the wrinkles out. If there's any excess, just let it be up here at the top because you can fold it down later. Okay, now we put the garment on. So this garment was fitted to this patient. This one was not. This is close. It's not an exact fit. So if I had actually measured her and gotten a garment for her, it would fit better than this one, but this was the closest I could get. So the best thing to do is, they tell you here, top. Look for that. That goes in the back, up at the top. So when I'm teaching a patient, I say look for top, back, and put that against their leg in the back. This Velcro can be crazy. It sticks. Look at this, it's sticking everything. So we want to anchor the top one first, just to kind of get it in place, because you've got this flailing everywhere. A best way to keep hold of this is close the Velcro on itself, and then it's not sticking to everything. So once we get the top one anchored, we come down to the bottom. Want to put the bottom one on first. You're just going to snug it around and then work your way up. Next for this one. And then this one. And then that one. You see a few wrinkles here because, again, this one was not measured exactly to her. You wouldn't normally see a wrinkle. And that's it. It's on. To tighten it, the patient would grab 2 at a time and pull. And 2 at a time and pull. And now she's got it tight. And that's all there is to it. Much easier for her to access, and most importantly, she can adjust it if she needs to. You know, let's say her swelling goes down during the day and this starts to get loose. With the dressings and with the hose, you don't have any way to tighten it, and sometimes they can slide. Not with these. They get loose, she just gives it a few adjustments, snugs it up a little more, and she's got it tight. That's what makes them last longer, because you can adjust them. As they start to wear out, you just pull them tighter. They're thicker, so they're much more durable, but they're also hotter. So if I had to say a downside, patients usually don't like these in the summertime and they start to get a little bit non-compliant. But I try to really scare them with, that's usually when you're going to get your wound also, so pick your poison. If there's leftover, pull it down. Now what about the foot? It also comes with a foot piece. Now this is the part that sometimes they can't put on, and if they can't put it on, so be it. As long as they monitor their foot and make sure they don't have a lot of swelling in the foot, or if they just have to put on a regular sock, again, it's better than nothing. It is a little bit difficult to put on, so again, if the patient can't get it on, I don't make them. But it's not as hard as putting stockings on, trust me. And I just let it pull up to the top over the outside of the dressing. You can take out your wrinkles if you need to. So there's your foot piece. So that's the garment. Okay, and that's Circade. And again, benefits, it's adjustable, it's much more durable, it's much easier for the patient to take on and off, it's going to last longer. Downsides, it's hot. That's about it. Let's look at another kind. Before we stop, this is another one Juso has, and it's reversible, so if they would rather do one side, one color more than the other, because the Velcro actually peels off, and you could put it on either side. And that way you could say today's going to be a light day or today's going to be a darker day, depending on where you put the Velcro, but it still goes on the same way. So when I'm teaching patients to take it off, I have them fold the Velcro against itself so that it doesn't lose its elasticity and strength by getting stuff embedded in it. And then they can go store it. It's done. Okay? Let's look at one other kind. Okay, the other popular compression garment that's out there is the Ready Wrap. Now, why would we choose Ready Wrap over the Circade? Well, you can see that the Ready Wrap has more options of Velcro wrapping. So sometimes if you need more control, a little bit tighter, I think the Ready Wrap is going to win out on that because you've got more ability to adjust, and Circade only has 4 primary straps, and sometimes with patients who have a lot of fluctuation, it's not comfortable for them, and edema can kind of go in between those 4 straps, but not with the Ready Wrap. Let's see how it goes on. It comes with a complete liner. It's basically very similar to an athletic compression sock, but it's not even as tight as a compression sock. But it provides a barrier. If they had a small wound, you'd have the dressing on and then put this on. But we're looking at someone who we're doing maintenance edema control. So we'll put her sock on. This is honestly probably about the same compression as a regular sock, if that. Okay, so when you put this on, make sure that you see your Velcro. Start with your solid Velcro here at the bottom, and it should taper out. So the first one should be the most readily available to go around the ankle. Okay, that's where you start. You want your solid one to be number 1. And then the next one is the small tab. It's always number 2. Kind of lay this against their back and pull, and then you find your solid one over here and meet it. And then on that same side is your tab again. Here's your tab, and it's coming around. And then you're going to come over here for the solid one. And if you notice, it's color-coded. So I had solid, now I need the tab again from over there. Once I get the tab, I'm looking for the solid one on the other side. It's color-coded. Now I'm going to need the tab from that side, right there. And then lastly is the solid one again. It's color-coded. Okay. Definitely a little more complex to put on, but you have much more control. Higher compression on this one because you've got more layers added to it. It's still adjustable like the previous one, but I probably wouldn't pick this one for patients who don't have good vision or have a little bit of trouble following directions that need simplicity. But I definitely would want this for patients who maybe have higher compression, that might be larger, have more than 40 millimeters mercury pressure in their legs, or are taller. This tends to be a little bit longer to maintain that control, and there's definitely no leaking between the seams the way sometimes the Circade can do if they have a lot of swelling. So this one is definitely superior for your heavier patients with higher compression. Definitely gives a little bit more square area and more symmetrical compression, but the downsides, it's a little bit harder to do, to put on. And I've had a few patients tell me that the Velcro didn't last as long as the other one. And if you notice, it's not as much of a Velcro area as the other wrap was. It had a thicker lip of Velcro. So I can see that that's a problem. Again, when you're storing it, if you fold it in on itself, it can help keep it from getting other stuff embedded in it. Okay, so that's all of our wrapping. And all of these are available if you want to look at them and actually get your hands on them and play with them. You know, the only way you're going to get good at wrapping is to actually practice.